Hello all, good afternoon in Dublin and good morning from New York. It's wonderful to be part of this workshop and hear about all the amazing science that's happening to bring better treatments and the possibility of cure to our cystinosis patients across the lifespan. I'm delighted to be here as a social worker and a researcher and an advocate to remind you about the lives of our patients, the lived experience of our patients, those who are adults now, and those who are on their way to adulthood. And I want to talk with you a little bit this morning about the work that's been done on their behalf, but more importantly, with them. Like others of you in this meeting, I've been working with the cystinosis community for many years, more than 20, in fact. The first transplant patient I ever cared for was a preteen with cystinosis. My first month on the job as a social worker at Montefiore with Rick Keskow. That preteen is now 33 years old. I've had the pleasure of watching her and many other young people in this community grow into amazing, joyful, kind, and resilient adults. There are many different journeys with cystinosis, beginning with managing their illness and finding healthcare teams they trust, but also encompassing education, work and career, relationships, becoming parents, traveling, and having adventures. It's wonderful to see. But there are many stumbling blocks and challenges along the way. Illness interferes and often takes away. College interrupted by the need for a kidney transplant. A loved career or job interrupted when a kidney starts to fail. Favorite sports or activities made harder by myopathy. Difficulties speaking or eating. New fears about their risks from COVID. Drug side effects and timing that impact every day. The painful full stop when one learns that a compatriot, a friend, another member of the cystinosis community has died of complications or progression of this disease. These are constant reminders for all of our clinical successes that this road can be very hard. These clinical successes, from the availability of cysteamine in the 80s right up to this moment with new drugs and gene therapy, have changed the lived experience of this disease in so many ways. Young people whose families were told they might not survive adolescence are now in their 20s, 30s, 40s, 50s, do I hear 60s? Living very full lives. Many are working, some are parents, some are becoming caregivers for their own parents who worked so hard to keep their child with cystinosis alive. All of you in this room should take pride in the fact that people with cystinosis are facing these challenges in adulthood. You made it happen. You can probably hear that I have a very personal connection to the cystinosis community. In some ways, it's because I've come of age right alongside them. I've been living with type 1 diabetes since I was 8 years old. So many treatment advances have happened for that disease since then, and yet the day-to-day remains challenging. I was 29 years old when I met that first cystinosis patient. I just turned 50 in quarantine with a Zoom party. But I look at the sequelae of that disease that I've experienced, and I know I wonder about what the future will bring, what aging will bring. Years ago, I transitioned into going away to college and living independently. But for a great deal of adulthood, there's been no guidebook, right? But there is an active community of advocacy and peer support, much like there is in cystinosis. So we've been able to start this great conversation about the transition to adulthood and adult-oriented care out of pediatrics into adulthood, and really ask, what does it mean to be an adult with cystinosis? What does independence look like? What does healthcare look like? I will tell you, we've set a standard in many ways for other rare disease groups to start these conversations. I just worked on a beautiful toolkit with the X-linked hypophosphatemia community, and we totally stole ideas from cystinosis. So we know that good transition planning and preparation is a setup for future success, but we can't stop there, not anymore. We have to look at adulthood itself. There's a long history of advocacy in the cystinosis community. It's why we're able to be here today. Because of caregivers and loved ones who organized to address the health and the unmet needs of their rare kids. Now, the advocates are also people living with cystinosis themselves. So we really have to keep thinking about the lives of our patients in full adulthood. We have to hear their voices, and we have to respond with our care and our research. I'm going to turn this over to my colleagues, Cheryl Simoens, who is the chair of the Adult Leadership Advocacy Board, also known as ALAB, and Karen Gledhill, who's one of the ALAB board members from the Cystinosis Research Network here in the US. We'll all be available for questions at the end, but they're going to tell you about the specific work that ALAB has been doing to connect adults with cystinosis to each other as peers, to connect with families with younger children for support and mentorship, and also hopefully to connect them to the community of clinicians and researchers who need to hear their voices. So Cheryl, I'm turning this over to you.
Hello, good afternoon, everyone. Thank you so much for that, Maya. I am thrilled to be discussing and advocating the ALAB on this platform today with so many of you medical researchers and experts. As Maya has said, I am the chair of the Adult Leadership Advisory Board, also known commonly as the ALAB. So I'm just going to talk a little bit about the introduction and sort of our goals and missions for the ALAB. The ALAB first initially convened in 2018, beginning with a group of 13 founding leaders, including myself and Karen, comprised of all adults and young adults with cystinosis over the age of 18. I myself currently live with nephropathic cystinosis and am currently in my mid-30s. So the board was created to propel leaders in the group forward to empower the entire cystinosis community through our own shared experiences, stories, ideas, and knowledge. Current and future members of the board are supported through excellent leadership training and development led by experts and external resources, and continual guidance by the board members from the Cystinosis Research Network, CRN, themselves. We are also encouraged to maintain and strengthen our own disease management and coping for future success and to better support and help others in the community. The structure and process for membership intake of the ALAB is completed through submission of applications with subsequent interviews for a 2-year term where leaders will be appointed on a rotational basis, and that will continue for the future. There are certain roles, including chair as myself, co-chair and secretary, that are selected after onboarding with the goal of completing administrative duties, moving action items or tasks forward, group organization, and external communication to ensure essentially future success for the board. Subcommittees will be formed and are currently starting to become formed with the intention of matching group members' strengths to particular areas of necessity or areas that definitely need highlighting to allow the group maximum efficiency, success, and time management, including things like social network and social media, so we can best and ideally inform others in the community from a social media standpoint, as well as external networking and finding resources that we can use for projects, etc. The mission of ALAB, stories and strength, to educate, motivate, and empower the entire cystinosis community. And our philosophy is simple. Those who have lived it can teach it. The intention of the board is ideally to provide support, education, inspiration, and a platform for other community members and their caregivers to share their voices and expand their minds to gain new perspectives, ideas through a variety of projects, which we will talk more on, events, and fundraising initiatives or efforts, including the cystinosis masks that Maya has shared. As most of you know, individuals with this disease are now living well into adulthood and into their 50s and potentially 60s. So the need for this guidance and support through groups such as our group ALAB is crucial at this point in time. Essentially, we're paving the way to provide tools, discussion over coping strategies, sharing stories, and connecting the community as more and more individuals move into adulthood and begin navigating a potentially unknown future. Each board member is dedicated and passionate about assisting the community with the balance of maintaining their desired lifestyles while managing their health conditions. A goal that the group hopes to achieve is opening up honest and transparent dialogue in discussing the challenges that we all face, the barriers, and any negative aspects of the disease, while highlighting associated coping strategies and a positive outlook and choices, and essentially come together to be there for each other. The group strives to provide an outlet through participation of these projects that we're creating for individuals to share their own experiences and stories, and for medical professionals to share information, allowing participants to become more knowledgeable on cystinosis, including treatment options and adherence, managing other aspects of their lives, such as work, employment, and relationships, navigating the healthcare system, and essentially building problem-solving skills. Those creating these ALAB project content are also developing teaching and leadership skills and finding new motivation to maintain and strengthen their own disease management and coping. Within this year, from 2019 to present day, members of the board have been very busy developing and implementing projects utilizing modern communication technologies to reach adolescent, young adult, and adults living with cystinosis within the community. The content of each project is relevant, up-to-date, and educational, providing community members a safe and nurturing space to join conversations, ask questions, and learn from each other. And for medical professionals and experts to share their information and support the entire community through knowledge. New materials and projects, along with fundraising efforts, will be developed over time as ALAB leadership and members rotates, and as new concerns arise, and as treatment advancements for this disease continue. I would now like to pass the floor to my ALAB colleague and secretary of the group, Gledhill, to further discuss some of our goals and more on the specific details of each project that we have been creating this year. I want to thank everyone for their time and for listening today. It's been a pleasure. Thank you.
Hello.
Hi, Karen.
Oh, hello. Good afternoon, everybody. My name is Gledhill. I am a late onset and cystinosis patient, and I am in my 60s, just so everybody knows. And I'm a contributor to the ALAB poster. Today, I will be speaking on the programs initiated by ALAB this year. As Cheryl said, ALAB was started with young adult, I'm a little bit older than them, patients that were chosen through various criteria by the CRN board to be their first advisory board. As we are all aware, because of research and medical advances, we are the first group of patients living well into adulthood. We want those that are following us to have an easier time with their journey by sharing our experiences. ALAB's philosophy is simple, as Cheryl said. Those that have lived it can teach it. We really believe that. After we became a board, the leadership training took place. Then the ALAB board was divided into 3 subcommittees. These subcommittees were tasked with brainstorming ideas and ways to reach the younger cystinosis population using the ever-evolving electronic media. Many of these ideas the ideas that were generated were passed along to the CRN board. CRN reviewed the ideas for ability to reach the target audience, content, ease of implementation, and the monetary investment. Our goal is to educate the younger population and give them the tools that we have found to work given their situations. We hope that sharing this already learned information will make it a bit easier for them. 3 ideas were chosen by CRN. In a strange twist of fate, nothing had to be altered to continue the programs given social distancing and the coronavirus. The 3 ideas started this year are Cystinosis Rare, A Journey into the Unknown. They were podcasts. This project is a high quality series of quarterly episodes hosted by individuals living with cystinosis. The episodes highlighted topics such as teen to adult transition, mental health, success stories, and educational system challenges. As an example, ALAB members are currently working on an episode focusing on transitioning from youth to adult care in the medical community. The episode includes a question and answer with Dr. Paul Grimm, a pediatric nephrologist, and Dora Rivera, a patient access manager, both residing in the US, answering questions from the community on managing medication, treatment, and self-advocacy. There will also be a panel of adults living with cystinosis sharing their stories and experiences on this topic. A true effort to support younger generations as they enter their own transition journey. The second program is called Cystinosis Sessions, which is video conferencing. This provides a face-to-face online platform to share experiences and educate younger cystinosis patients, parents, caregivers, and healthcare professionals in a knowledgeable and comfortable virtual environment. I'm very happy to say that this is my group. We have hosted 4 sessions. Our latest session was last Saturday and featured a talk on mental illness, moderated by Maya, who was our first speaker. And what I really like is joining our sessions have been participants from Canada, the States, Australia, England, and Germany. Around the world, the cystinosis community seems to share the same ideas and issues. Our third and final program is called Cystinosis Teens. It's Instagram updates. This provides a private closed account moderated by ALAB members, focusing on challenging issues, mental health issues, spotlighting and highlighting their successes, and we're hoping become a safe forum for our teens to chat and share ideas. We hope that this content will strengthen the knowledge of cystinosis patients and help them in all aspects of their life. These programs have been well received, and we believe we are making strides into our younger community. We also want healthcare providers and researchers to recognize the fact that cystinosis patients are well versed in their own disease and can speak about how it impacts their lives. Having a rare disease, we believe, means you have to be your best advocate and educate yourself. The hope is that the ALAB members' experiences will make it a bit easier for those that are following, and the bonds created by these programs will make every member feel like they are not alone in their journey. Thank you very much for your time. I love Dublin. I'm going to pass the floor, or as in this case, the camera, back to Maya for some closing thoughts. Thank you very much.
Thank you very
Karen and
much.
Cheryl.
Thank you very much, Maya, Cheryl, and Karen. It was really exciting to see all of you and also to hear your story, and also actually an extremely success story of ALAB, and congratulations for the abbreviation also, ALAB. It sounds so good, and it really connects the patient community with research. So I think your presentation was extremely motivating also for many young researchers and also older researchers, you know, like listening while they are working and how they can really try to improve life of the patients who are living with the disease. So thank you so much.